The gruesome rape and murder of a 31-year-old trainee doctor inside a hospital at the heart of Kolkata has shed light on the inadequate safety protocols for medical professionals in India. While the horrific incident drew condemnation for the West Bengal government and the police for the way they handled the case in the first few days, it has brought to light a larger question. How safe are doctors at workplaces? The Supreme Court, which took suo motu cognizance of the matter, formed a task force to prepare a plan to ensure safety of medical professionals at workplaces. Now, joining us right now, we have one of the members of the task force, Dr Saumitra Rawat. He's joining us. He's also the chairperson of Institute of Surgical Gastroenterology at Sir Gangaram Hospital in New Delhi. We also have Lieutenant General Dr Madhuri Kanitkar. She's also the Vice Chancellor of Maharashtra University of Health Sciences in Nashik. Thank you very much for joining us, Lieutenant General Kanitkar and also Dr Rawat. Dr Rawat, if I can begin with you. You're a member of the task force which has to submit an interim report in the next 3 weeks and final recommendations in 3 months. When is the first meeting going to take place?
Thank you very much for inviting me, Parikshit. I think we haven't received any notification yet. I think it'll come in a day or two. And as soon as that happens, we will have our first meeting. But as you said that, we need to submit our interim report within 3 weeks. That is what our plan is. I've spoken to some of the others, members of the task force, and we have already started formulating the protocol and the recommendations.
All right. Now, there were 8 or 9 points that the Supreme Court raised in terms of the action plan for the National Task Force. One was to prevent gender-based violence, a national plan to prepare dignified working norms for interns, residents, non-resident doctors, areas of emergency room which need additional security, security to manage crowds, restrooms for doctors, gender-neutral spaces. Among these, which do you think are an immediate priority and which are absolutely non-negotiable?
I think, Parikshit, all these points are absolutely valid, and I must congratulate Honorable Justice D.Y. Chandrachud that he has gone absolutely to the minutest of detail, and he has given us a guideline that these are the minimum area where we will be submitting our recommendations. And they have also mentioned that any other areas which we would like to add. All these are absolutely important. I think the security is a concern at the moment. I think if you read the judgment, it says, 2 things. One is preventing violence against medical profession, and secondly is developing a national protocol for dignified and safe working conditions for the doctors, junior doctors, interns, and nurses, and all medical professionals. So these are the 2 things we will be working, and these are the subheadings which you have very clearly mentioned.
Right. Let me also get in Lieutenant General Kanitkar at this stage. Lieutenant General Kanitkar, if we look at this horrific violence, rape and murder case that has taken place in West Bengal, keeping the circumstances in mind, and also the fact that the Supreme Court also noted that there are legislations for the safety and protection of medical professionals at the state level and central level, where do you think there are gaps in implementation?
Firstly, I think just legislations means nothing unless they're enacted upon. And like Dr. Saumitra brought out, the Honorable Chief Justice in the Supreme Court brought it out so beautifully that there are huge lacunae in implementation. And the problems are coming up. I think if I have to sum it up, I think it's a tea, a cup of chai. And I think it's a tea. First, there's a lack of trust between patient and doctor, trust between doctor and administration. So there's a trust deficit, which is a whole big gap. Second is empowerment. It's not just about sexual harassment or this thing of a woman. It's about a safe place which is gender neutral. There may be sexual violence for women, but I don't think it's safe for the men either. That is why it's toppled the apple cart finally when it's reached such a bad state. So in that, I think you need to empower the doctors and the people and give them systems in place which has to be have something beyond what the doctor is supposed to. It can't be he himself looking after patient and his own safety. So you have to empower him with tools which will help this thing. And the most important is accountability. I think that TA is the accountability of not just the administrations of the hospital, but of the hospital, especially in the public domain, are being held, finally it is government, bureaucracy, there's everyone. So there has to be an accountability for things which are not implemented. The time is over for band-aid therapy. It needs a complete overhaul with timelines for implementation and an accountability beyond just doctors.
Right. Dr. Rawat, that's a very important point that Lieutenant General Kanitkar has made. Over here, what we're talking about is a horrific rape and murder case which actually took place in a medical college. Now, you've got women serving in remote corners of the country. They are putting their own lives at risks at times when they are maybe working in places which are not very safe for women. Now, what protocols, in terms of the preliminary discussions that you've had with certain colleagues of the task force, what are some of the measures that women doctors actually need for their safety?
I think the most important thing is to provide them a absolutely safe and secure atmosphere. So as it's been mentioned, that we need to provide the additional security in emergency room. We need to provide security to manage the crowd. There should be a restroom, and restroom should be accessible only to the doctor and the staff. Patient and their relatives should not go there. And in a bigger places, you need to have a biometric and facial recognition, proper lighting and installation of CCTV. Parikshit, I have worked in UK for 17 years. So, I know about the system there also, that how much, we used to do there for a dignified and safe working condition for our junior doctors. These are the future medical staff of the country. We need to look after them well, and we need to make a standardized protocol for all the doctors all over India. This is not about a particular place. It's about all the healthcare institution and the hospital around the countries. We need to provide a safe, safe atmosphere. Currently, I'm working in Sir Gangaram Hospital, as you mentioned. We are the largest training center for National Board of Examination. We have got 350 DNB and doctorate student working for us. So, but the management is very proactive. If any complaint comes, we look into it in depth and we try to resolve as soon as possible. I think as Lieutenant General Madhuri Kanitkar also mentioned, that trust deficit, we need to, go beyond trust deficit unless and until we look after our junior doctors well, and we need to, look after female doctors well. In UK, we are getting a lot of female doctors in the medical profession. And now if you look at any medical college,
Dr. Rawat,
more than 50% are females.
Dr. Rawat, because I'm running out of time, I want to put quick questions to both of you. One question more that I'd like to ask you, Dr. Rawat. Would you consider recommending harsher penal provisions, punishment for anyone who harms doctors, attacks doctors on duty?
Absolutely, absolutely. If if the punishment doesn't have a teeth, it doesn't mean anything. It has to be time bound, and it has to be a significant punishment. Otherwise, there won't be any fear.
All right. Lieutenant General Kanitkar, any final thoughts on one key expectation that you may have?
I think the biggest thing, this thing of it's not just the task force needs to look beyond the violence and prevention, but look at why it is happening. If that can be also addressed, because the maximum violence is happening in public hospitals, in government hospitals, which are overcrowded, understaffed, lacking basic amenities. So I think if those can be addressed, the tolerance levels of patients as well as the doctors, them working. So we can look at a larger perspective. We would fix the problems, but we also need to look at why these problems are occurring.
All right. Thank you very much, Lieutenant General Kanitkar and Dr. Rawat, for joining us on